Hi, it's Dr. Sandy Laura Kramers. Welcome to the EYE show again. Thank you for joining us. I'm one of the surgeons at Visionary Eye Doctors, and this is podcast number 30. So please continue to pass this on to friends and family and to subscribe. And thank you to all of you who have reached out to us from around the world to thank us for the podcast and give us suggestions. And today we're going to talk about one of the big things with dry eye disease is a whole group of patients that are dark-skinned, African Americans, dark-skinned Asians. When we talk about helping dry eyes, we have a whole wonderful armamentarium of help for patients. We've talked about before the ways to help save the meibomian glands, which produce the oil located in the eyelid. We have warm compresses, LipiFlow, intense pulse light, and probing. So those have been the things we've talked about in the past. And we love one of them in particular called intense pulse light. It's been used, and we've talked about this in previous podcasts, for years. It's been used for cosmetic issues, whether you're a woman with wrinkles or want to get rid of a tattoo or want to get rid of hair, help improve the texture of your skin. Intense pulse light is wonderful. However, it is not meant for patients with a certain colored skin. It's called Fitzpatrick typing of skin. And Fitzpatrick has a scale from about 0 to 6. I'm about a Fitzpatrick 4 or 5, depending on how tan I am, how much I've been in the sun. But patients who are a little bit darker than me, or even my skin color, may not be candidates for intense pulse light for various reasons, but particularly because it can leave a white discoloration of your skin. And if it's, a part of your back and you want to get rid of your hair, and if you're a male, it might not be a big deal. But if you're a woman, you don't want any discoloration of your face, obviously. So it has always been the case since we've been using intense pulse light for the last 9 years or so for dry eye disease that we tell African American patients and very dark-skinned Asians, patients from India and so forth, that you can't have intense pulse light. The problem with that is that there's really very little else to help save those glands. We still have the warm compresses and blinking, we still have LipiFlow, we still have probing, and we love those. Those work great. But as I've showed patients before, and just to show those watching on YouTube, the normal meibomian glands look like these white piano keys we've talked about, but if you have very few glands left, LipiFlow is good to save what you have, but it won't really always help with the symptom relief if you already have very few glands left. Probing is excellent at opening up the orifice and breaking open the scar tissue in the gland, but it's not the best for keeping the oil pumping, especially in patients that can't do warm compresses because their skin is too sensitive to the heat, or they just don't have time. So intense pulse light is that intermediary component that we love to use to keep the oil pumping, to liquefy the oil. It helps the collagen formation in the eyelid to some extent. That seems to help kind of more long term. But if you're African American, we used to say to patients, don't even try, until very recently. So in the last year, we've had a few, I'd say now we're about 7 patients, so it's not that many just yet, but 7 very dark-skinned patients, Fitzpatrick 5 and 6, who have willing to take the risk of trying the intense pulse light on their eyelid. And we have been pleasantly surprised. So the way our protocol for this is very simple. We always do a test spot on a similar part of the body that has a similar skin color. Usually it'll be the back of the arm or the thigh, something that does get sun exposure. We will always tell these patients to make sure they're not in the sun or very little sun, because that can affect the risk of depigmentation after intense pulse light. And then we do the lowest settings on the intense pulse light for the dry eye protocol. So what we first start off with is that test spot. We give it 24 hours. They send us a picture. We take one before. They send us a picture after. Make sure there's no discoloration, no redness. If everything looks good after a day or 2, we usually can proceed. When we do the intense pulse light, we usually only do 3 shots on the lower lid, 1 shot on the upper lid. And the way we do it is we go 1, 2, 3, just like that, in terms of the vertical versus horizontal component of the intense pulse light. So the minimum possible, to just in case there's any reaction, we don't want anything to go negatively. All the patients so far have had both eyes treated. There is one patient coming up where we're going to just do one eye because she's very dark and she doesn't want to risk anything. So that's an option too, but she's suffering so much from the dry eye that this is the next best step we have in terms of after warm compresses. And if LipiFlow is not helping, intense pulse light is a great option. So for those watching on YouTube, I want to show you an African American patient. Her skin color is much darker than mine. She was 6 Fitzpatrick type 5. She probably would be 6 on a day where she was in the sun, but we told her not to be in the sun. And so what she had was quite a lot of relief. She started off at a 10 out of 10 discomfort. I just want to play this a little bit here for you guys while I talk over. And so she had originally 10 out of 10 discomfort. You can see her skin color in the background, very dark colored iris, and she had LipiFlow in the past with very little relief. This is her first intense pulse light, and we already are getting to see the kind of thick toothpaste secretions coming out of the eyelid. Very exciting because this is after just 3 shots with a 10 millijoule IPL treatment. So we have a lot of oil coming out. After she had about 3 treatments and her symptoms improved, and she might need more to get to that olive oil stage, but you can see quite a lot of oil coming out of her glands. And this is oil that's been stuck for probably a very, very long time. And so as we go through here, just to show you a couple more on the upper lid. So both, we treated the lower lid and the upper lid. So just because a patient is a dark-skinned patient, whether they're African American or Indian, this doesn't necessarily mean they cannot have intense pulse light. Under the right protocol, it is an option. There is still that risk of discoloration. None of our patients so far have had it, any discoloration, and no side effects, but it's still a risk. So this is what this expression looks like. We are very excited about this. We generally will tell these types of patients to come back every 2 or 3 weeks as long as their skin is having no side effects from this. So intense pulse light in African American patients and dark skin other patients, Asian patients, is an option done under very careful circumstances. Please pass this on to your friends and family. If you are feeling your eyes or having any discomfort, know that's not normal, and please connect with us or your local IMD. Thank you so much.